Welcome back. Today we're going to look more carefully at cognitive assessments you can do in a primary care setting. Today will be part one of a three-part series covering the Montreal Cognitive Assessment, or MoCA. While the MoCA was primarily validated as a screening tool, it can also be part of the diagnostic workup for a patient you've identified at risk for dementia. When you have a patient who you feel is high risk for dementia, there are really 5 components that will make up a full diagnostic workup of that individual. First is getting a full medical history. Next is completing a physical exam. One important part of the physical exam will be assessment of multiple cognitive domains. That's where the rest of today's video will focus as we talk about the MoCA assessment. The last 2 essentials of a diagnostic workup are laboratory tests and then brain imaging. We will discuss these in a future video. Let's look more in depth now at the Montreal Cognitive Assessment tool. Keep in mind it was designed to detect mild cognitive impairment in early stages of a number of different kinds of dementia. It was standardized for individuals with 12 years of education, and it covers key cognitive domains, including those that are of most interest to us if we're looking for patients with early stage illness. These would be amnesia or memory loss, language abilities, visual, spatial, and executive function. Watch now as I start the exam with the Trails A item.
Now, you know some of these questions are more difficult than others. Just do your best.
Okay.
If you have any questions, let me know. I can repeat the instructions, that kind of thing.
The trail-making item is an evaluation of both executive function as well as visual spatial abilities. The trail-making item tends to be one of the more difficult for patients. I've found that if you use the instructions that I've provided here, word for word, the patients really do have a better time understanding the directions.
Okay.
I'm going to let you start with this. Take that. Focus right here for me. This is kind of a connect the dots sort of thing, but here's what I need you to do. I want you to draw for me a line connecting in ascending order the numbers and letters following the pattern that you see they've started for you. Okay? You can draw over their line.
Okay.
And then get to the 2.
So do the number first?
Start here at the 1 at begin.
Like here.
Draw over their line.
Like that.
Yes, ma'am.
And then B.
And now you go on from the 2 until you get over here at the end. Follow the same pattern.
Okay. That would be 3. That would be 4. Oh, no. It's A, B. Oh, I'm sorry. 1A. It should go like this, B2.
You can go ahead and write.
Can I do it?
You can.
I think.
I'll fix it later.
Or 1A, 2B, 3C, 4D, 5E.
Excellent. I'm going to just take a pen here and write a little X here with my initials.
Now, did I do it right the second time?
Yes, ma'am.
I thought so.
All right. Okay.
As far as scoring, it's pretty straightforward. If they follow the pattern of moving from the number to a letter, continuing to the next number, then the next letter, without drawing any lines that cross each other, then they get a score of 1 point. If they correct an error themselves, they also get the score. Since our patient made an error but caught it herself, she did get full credit.
Now, here I want you to just copy this cube right down there.
Okay.
The next item, drawing the cube, is a visual spatial task. Directions are straightforward. Ask the patient to copy the cube as accurately as they can in the space below. Scoring involves several elements. It needs to be a 3-dimensional drawing. The lines should all be drawn. They cannot have any additional lines. And you want to have lines that are relatively parallel with similar length. It is acceptable for them to end up with a rectangular prism instead of a square.
All right. Now, in this space here, I want you to draw for me the face of a clock
Okay.
I want it to have all the numbers on it, and I want the time on the clock to show 10 minutes past 11.
The clock is also a test of both visual spatial, visual constructional, and executive function. The instructions need to be very clear. Draw a clock, put all the numbers on the clock, and set the time to 10 minutes past 11. Keep in mind that this is not a memory test per se, so you may repeat the instructions if the patient asks.
10 minutes before 5?
10 minutes past 11.
Oh, where did I get 5? Jeez.
Scoring the clock consists of 3 main areas. First, contour. You really want to see a circle that's closed and without any major distortions. A square or rectangle is acceptable as long as, again, it's a closed figure. Next, look at their numbers. All the numbers 1 through 12 should be present. There should be no additional numbers. The numbers should be in the correct order and placed in approximately the correct quadrants on the clock face. Some patients will use Roman numerals, and that's fine. Some patients will put the numbers outside the contour of the circle. That's fine as well. Finally, the hands. There should be 2 hands clearly identified. They should be just about near the center of the shape. There should be 1 hand that's clearly the short hand and 1 hand longer. You may have to ask the patient to identify the short and long hand if they haven't drawn it clearly. So there are 3 points total, and if patients are missing any of the elements we talked about, they do not get a point for that component.
Yeah, it's got to be there.
You happy with that? Okay.
Yeah.
All right, I'll take the pen from here on out.
So let's look again at our patient's performance. On the Trails A, she started out and made some errors, but provided self-correction, and so ultimately I gave her full credit, but I did note that she had made the correction. On her cube, here's an example where she really made more of a rectangle, but she does have the preservation of the parallel lines and included all the lines without any extras. So she gets full credit for that. In looking at her clock, I think you could argue that the numbers aren't perfectly spaced, but she does have a contour that's a closed circle. The numbers are generally in the right area, filling all 4 quadrants, and her time is correctly identified with a clear identification of a short and long hand. So I gave her full credit. Thanks for viewing today. Next week we'll look at part 2. If at some point you want to see a MoCA being completed in its entirety, that video will also be posted on the main website.